Once that study came out and the results were published in 2002, before that, on average, 1 in 3 women who were qualified to be on hormone replacement therapy were on hormone replacement therapy before that study. So 33%, 35% was on it. After that study came out, just based on the decrease in sales of Prempro and Premarin as data points, it fell to 5%.
And statistics on menopause and menopause symptoms, 80 to 90% of women will experience symptoms during menopause. A third of women will have debilitating symptoms that affect their daily quality of life. Mm-hmm. And so if you think of it, a third of it, that sort of correlates with the number of women that were on hormone replacement therapy at the time. They got desperate enough that they needed to do something. And so that is a huge, huge, huge number of women that are suffering out there, trying to basically tough through it with these incredible side effects. We talk now about, estrogen is for bone health, brain health, and heart health, prevent heart disease. But there are so many other things that are side effects that truly can affect daily quality of life. Poor sleep, insomnia, weight gain, anxiety, depression, fatigue, vaginal dryness, loss of libido. The list goes on. It's not just night sweats and hot flashes. And those things truly were affecting women's daily life.
Yeah. And isn't it fascinating with all those things that were happening that are debilitating? Nobody did anything about it.
No.
Like for 20 years or more, like 2025, 2002, 23 years later, right?
Right.
We are just now removing this black box warning after so many people have been complaining from the top of the mountains about this issue and poking holes in the study that just set everybody backwards for 20, 30 years, right? And then now we're going to have to wait another 5 to 10 years before it becomes norm, because guess what? There's few and far between medical practitioners who will educate themselves on this. And you just talked about how academia moves at the pace they move.
Yeah.
And that's who's educating tomorrow's practitioners.
That's right.
So
where are we going to stop the madness?
Yeah. How do we get ahead of this, right?
It is, I have seen literally a handful of patients that their husbands were OB-GYNs. And they came to me for hormone help because if you're a practicing OB-GYN out there and you're trying to deliver babies and see patients in the office and keep your office afloat and deal with insurance and all of those things, you don't have time to go take a hormone course. And, you don't even probably have the interest nor the energy levels. And so what I have heard the most from my hormone patients is that they went and asked somebody to check that, whether it was a gynecologist, primary care, whatever, please check my hormones. And they were basically dismissed and offered an antidepressant.